Hey, it's Dr. Manny for AskDrManny.com. I want to talk today about a condition called vulvodynia. This is a chronic pain condition of the vulva, in other words, of the vagina for many women. This is a condition that is quite debilitating because it really interferes with not only the everyday life of many women, but also their social life. Now, the typical presentation is you have a woman that begins to complain about painful intercourse. She goes to the gynecologist. They don't see anything wrong. They do perhaps several tests, and the doctor basically says, well, we don't see anything wrong. Go back and try it again. But nonetheless, this woman keeps having vaginal discomfort with or without sex. And she gets to the point that she gets discouraged. She is just even afraid to talk about it because nobody's listening to her. But vulvodynia is a real medical condition. Now, in order to make the diagnosis, the doctor has to be very thorough in their examination. Sometimes women with vulvodynia, even if you put a Q-tip in the outer part of the vagina, it's very painful for them. We still don't know the exact mechanism as to why this develops, but it seems that women that have chronic pelvic infections, chronic yeast infections that are inappropriately treated over time could develop this condition. So one of the messages that I have is that, vaginal health is very important at any age, but especially in the 20s and 30s, because you want to go to your gynecologist on a regular basis and you want to treat all vaginal infections properly. There are things that you can do. You can monitor your vaginal pH, and there are things that you can buy on the internet or in a pharmacy, which you can measure the vaginal pH, in other words, the acidity of the vaginal mucosa, because sometimes you can alter that with diet, and ultimately, by having a normal pH in the vagina, the natural bacteria that's supposed to be there gets corrected. There are other treatments, of course, that deal with the specific infections, yeast infections, which are very important. There are things like medications like antidepressants, certain antidepressants like not the SSRIs, but the tricyclic antidepressants have been shown to show some benefit in as a way to enhance or decrease, if you will, the pain in vulvodynia. But it is a true disease. It affects a lot of women. And also, the other message that I want to have in this blog is that if you go to your doctor and he or she does not feel comfortable treating it, or you don't get the right answers, as we always say here or any place that I speak, get a second opinion, because one of the things is you don't want to be discouraged. You want to find the answers, and you're going to find a doctor that perhaps knows a lot about it. So I'm Dr. Manny. Keep watching all our blogs and AskDrManny.com.